Hey, everybody. Welcome back to the She Found Motherhood podcast. Today, I have the absolute pleasure of chatting with Dr. Kelly Casperson. Dr. Casperson is a urologist and has advanced training in pelvic medicine and surgery. She's also a sex expert. And today, we dive deep into talking about sex and intimacy in pregnancy and postpartum. We had such an amazing conversation, and I can't wait to get into it right after this quick message. Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Welcome, Dr. Kelly Casperson, to the She Found Motherhood podcast. I'm so excited to have you here.
Thank you for having me.
After our technical difficulties at the beginning, I'd love to just start by getting you to introduce yourself. Tell us a bit about who you are, your background, and how you got into the work that you do.
Yeah. I love telling this story because it's really a story of having a career and then pivoting, and you never think that's going to be you. So I'm a urologist. I'm a mom. I have two beautiful, amazing girls. I was just a private practice urologist doing my thing in Northern Washington State. And I had a patient who I had known for about 5 years because I had cured her cancer. I took out her bladder, big operation. And that was fine. That was in her past. We just did a once-a-year checkup. And she was crying in my office because her intimate life with her husband, who she loved very much, was non-existent. And she felt so broken. And I didn't know how to help her. I was taught in residency that women are complicated and we're not ever going to figure them out. And we just give Viagra to the men because that's easy. So I started to actually question the beliefs I'd been taught. Is it true? Is it true nobody knows anything about women's sexual function? Is it true that we're just broken? And so I really started to question what we had been taught and dove deep into that. And about 6 months later, there's a voice in my head and the voice was like, you have to talk. You have to talk. And I'm like, I finally realized seeing people for 15 minutes at a time in my clinic was not going to change the world. And certainly 15 minutes in a clinic is not even going to change one person's life. You need more information when you've been given, number one, no information, or number two, completely inaccurate information. And so I started the podcast called You Are Not Broken because I just kept repeating You're Not Broken to all these women who they're like, I never have an orgasm when you put a penis in my vagina. Oh, you're not broken. That's not how we have orgasms. Oh, nobody ever told you that? Sorry. So I just kept repeating, you're not broken, you're not broken. And I'm like, of course, that's the name of the podcast.
Yeah.
So that's the story. The book, You Are Not Broken, Stop Shooting All Over Your Sex Life, is going to be coming out probably early summer.
Amazing.
So, yeah, because we just should all over. You're in the baby, pregnancy, and postpartum, we just should all over them. You should just be thin again. You should just be exercising. You should just feel happy. You should just want sex. All these shoulds is that actually reality? And if it's not, why are we feeling so bad about it? It's just another layer of pressure. Can we at least not feel bad about what's going on? Can we at least take that pressure off of us? So long story short, the podcast is a raging, amazing success. Turns out we all need to hear this information.
Yeah.
Yeah.
It's just, and I can't believe it's 2022. And
I can't believe it either.
Just bringing this into the conversation.
I can't believe it. I was telling a friend the other day, I'm like, how is it possible that I am part of a revolution? That blows my mind. The revolutions were already supposed to have happened with my mom's generation.
Yes, exactly.
So it blows my mind. I'm like, how am I part of changing the world? I don't know. I'm always constantly blown by it.
And I think it's exciting. We briefly talked about before, providers coming into this space, whether it be podcast or social media, and really infiltrating, articulate, evidence-based information that I think it's information that empowers, right?
Yeah. And I'm sure you get it all the time too, of like how many women have told me, because of you, I knew how to talk to my doctor. Because of you, I knew what to ask for. Because of you, I left the office with a vaginal estrogen prescription, right? If you have information going in to see a provider, it's such a higher level visit because you're not starting from breaking down all the false things you know.
Oh, exactly. And having that information and knowing what to ask and knowing what is normal in quotations, because I don't always love that term.
Yeah.
And I think when we were talking about this conversation, we wanted to focus around sex and intimacy and pregnancy and postpartum in particular. I feel like it's such a vulnerable time in a person's life because your body is so different. And whether you've had a cesarean birth or a vaginal birth, like everything's changed down there.
Nobody tells anybody that. And why do we not tell people that? Are we trying to protect women? We don't actually want to tell them how bad it can be? Do you think we're going to make everybody not have babies? Like, we're still going to have babies. We're just going to be more informed having babies. So it's bizarre to me why. And my counter argument is like, we actually told people what happens. Like, maybe that's actually really good birth control. Don't do it till you're really ready. Like, your bladder might not ever be the same, as part of like, oh, maybe I should just really try not to be pregnant until I'm really ready for it.
Yeah.
But once you're really ready for it, knowing what might happen, and again, everybody's experience is different.
Totally. And I think the hard thing is that let's take pregnancy as an example. And I'd be interested to hear your experience in this, but I find people are generally in two camps when they're pregnant. Either they are, feel amazing in their bodies and they feel that they have an urge to be intimate with their partner, or they are the opposite and have no desire to be intimate. And it's really challenging, I think, for people, especially for those that maybe don't desire any sexual intimacy with their partners during pregnancy. They feel like there's a lot of shame and they're shoulding, right? Like I should want to have sex. And I don't know if you have any thoughts or if you want to share your sort of knowledge and experience around during pregnancy and advice around people how to approach their sexual health and their desires or lack thereof in pregnancy.
I think not the first thing, but an important thing we don't think about is like raging hormones, right? Like where our estrogen has to be to maintain a pregnancy and where our testosterone is to maintain a pregnancy, we might have a crazy sex drive that we've actually never had before. And your partner is having their own experience of this person is shifting in her role. She's going to be a mom. Well, am I attracted to pregnant people? Am I not attracted to pregnant people? Her body is changing rapidly. There's so much going on that there isn't like, this is how you should behave. But just realize, yeah, there's a lot to process, especially when there's two people, right? The pregnant person and the not pregnant person. And they all have their own thoughts and feelings and past experiences with this.
Yeah. And I think that's so important is just having that ability with your partner to be able to have open and honest conversation.
Yeah. I think the thing we don't talk about a lot, and I love having a conversation about it, is like what we make other people's actions mean. And this is the life coachy part of me, but it's like, he rejected me. That means I'm unlovable. I'm going to be rejected forever. He's cheating. Like we just add all these extra layers on. And once you start paying attention to you doing that, you'll notice you're doing it, right? Like, why is he doing that? Clearly because, and it's the way our brain works. We add all these additional layers onto, maybe he's just tired, or maybe if you asked him, you'd actually get the right answer. But like we layer on all of these, I'd say false beliefs because we haven't even checked in with the person of if they're true or not. But that's, again, I call it like the 10 pounds of extra bricks we carry in our backpack. Like it's enough that we're just pregnant and our bodies are changing and our relationship's changing. And then we add on all these assumptions into the relationship, which doesn't help.
No, totally. Do you have any recommendations, resources for people? I'm sure you have a ton, particularly around, I think that's one of the biggest things I see. So as a maternity provider, but also as a family physician, is partners just not having that ease of communication when it comes to their sexual health. Like it's so funny. This isn't exactly sexual health, but I mentioned something to one of my good girlfriends the other day about using the bathroom in front of my husband or farting or something. They're like, oh my God, I still don't fart in front of my husband. And I'm like, you guys have had two kids together. What? And so if there's no comfort in some of those bodily functions, then how are we going to have comfort in the conversation around sex, which is another bodily function? And so whether you have recommendations of your podcast, other, resources, books, anything that we could recommend people have a listen to, if the first step for them is just opening the communication.
Yeah. One book that it keeps coming back is called Rekindling Desire by Barry McCarthy. It's not specifically for pregnancy postpartum, but it's really for the more like sexless marriage. Like we've been avoiding this for a long time. And it talks about how important it is to communicate. Not just start having sex again, but like communicate about like, why am I avoiding this? What does sex mean to you? I think why this topic is so cool and why I have a podcast on it is that I think being able to talk about sexual health and like your past and your feelings, like this is like the pinnacle of personal growth, people. And if you want to take it as a challenge, if you're comfortable talking about your needs, your feelings, and then being a good listener, right? How do you listen to somebody else's needs and feelings in a non-judgmental way and just hold space so that they feel safe and that they feel welcome? It's like, yeah, the topic's sex, but it's like those skills that you get to develop in being able to talk about sex, they're superpowers.
Totally. Then you can
It's you can do anything. You can talk about anything. So it's not that it's like sex exceptionalism. Yeah, but this one topic, no, it's just learning how to be heard, communicate, talk about feelings, be non-judgmental. Like it all helps. And I always say talking about sex, that's where the intimacy is.
Yeah.
It's not actually just what position do you want to use. It's like talking about what do you need? How often do you need it? What does sex mean to you? Do you know what sex means to your partner? Do you know, do they use it for love, connection, stress relief, to help them sleep? Right? Like, do you know what sex is to them? Those are superpowers and that's super intimate once you guys have that conversation. It's not, I make it sound like the weather because this is what I do for my job. But I want to acknowledge like most of us come from, let's avoid it. It's shameful. It's dirty. If you talk about sex, that means you're a whore or a loose or whatever it means for a woman to be comfortable talking about sex. We all have that judgment and those layers. So it's not easy, but your personal growth will just go through the roof.
Yeah, and it's so important. And I think you don't necessarily think about how important those conversations are. Oftentimes, trying to get pregnant or the beginning of a relationship, you're not necessarily thinking about that. Like you said, pregnancy brings so many changes, and then birth and postpartum, that is a huge change physically, emotionally, and as a relationship. And I think if you can strengthen that bond and lay the groundwork for the communication in pregnancy, it's going to make postpartum so much easier. I think that I would say probably a lot of people listening are on the other side of pregnancy and birth. And one of the biggest things I hear is, I have no libido. I don't want to have sex. I'm too tired. Or there's pain, right? A lot of people have pain with sexual intercourse after a baby. And I'm too tired. I'd rather do the laundry. Like all of this, it's huge.
Yeah, totally. And I think when people are like, I don't think we can talk about sex, we're like, how's not talking about it? Like it's usually working poorly. So you get to the point where you're like, well, what do you have to lose? It's not going well to begin with. But normalizing how difficult sex life is when you bring a baby into the picture. Like the data is 70% of people struggle with sex after having a baby.
Wow. I didn't realize.
Yeah, it's very high. And it normalizes to, again, it depends how what study you look at, but normalizes to like the people who don't have the baby at about a year. We have this myth, you see your OB at 6 weeks. Okay, go back to your regular activities. At 6 weeks, man. You haven't even had a night's sleep.
No.
And all the other pieces that affect your sex life, right? Like sleep, like hormones, like prolactin, like how blunted orgasm response is when you're pumping out prolactin to make breast milk. And then you just feel, oh, something's wrong with me. I just can't orgasm anymore. Like that tends to get better once the breastfeeding ends and you again focus on your pleasure. But that's just a hormone thing. So it's just normalizing it for so many people. And again, what does it mean? Just is the male partner or the non-childbirth partner feeling rejected because she doesn't want to have sex with them when she's like, my breasts they already have a full-time job. They actually feel very non-sexual at this moment. Just acknowledging that instead of he's making it mean he's rejected. He's making it mean she doesn't love him anymore. Instead of I've got stuff attached to me like 8 hours of the day. I can't even imagine this being a sexual organ right now.
Totally. Oh my God. I know I've had 3 kids and my breasts are like, I feel like they're not part of my sexual body anymore. And that's something that probably like I could work on and I could talk to my husband about that because I'm just like, oh, I'm over it. They've been in business for long enough.
Right. Yeah. They got a job. They had a career change.
Totally. Like thinking about 3 kids from 2013 to 2017, I was basically like, or 2018 was basically pregnant or breastfeeding. That's 5 years. They were busy. They need a rest.
They're busy.
And let's talk a little bit about the actual physical changes. And one big thing we get a lot of questions around is pain with intercourse after having a baby. Now we always recommend pelvic physio and all that, but just, do you have any information about how common that is and how to have conversations around that with your partner?
Yeah, it's super common. I think it's higher in the vaginal delivery camp.
Yeah.
Right.
Yes.
So we have more tears. Episiotomies don't happen too much anymore, but there are some. If the baby's stuck, you got to get the baby out.
Yeah.
Sometimes the vagina takes the hit.
Yeah.
So they're just physical changes or tears or stitches or whatever it might, or you're just bleeding for a long time afterwards.
Mhm.
So there's physical changes. And part of that's hormone changes.
Mhm.
So arousal might be more challenging. Again, you got prolactin. You've got you basically went from like estrogens in the thousands to estrogens of 0 overnight. You literally just felt menopause happen overnight. Just incredibly dramatic body changes, which if people don't know that, it's hard to understand, like, what's going on with you. I literally, like, to a male equivalent to understand this, you literally had testicles one day, and then I literally cut them off and said, what's wrong with you? Why are you just feeling so different? It's a dramatic change in hormones. But again, if we don't understand that, we don't have education around it, but the more we understand, oh, it's like taking testicles off. Yeah, you might feel really crappy.
Yeah.
Right. But you just to, again, put it into terms that somebody else can understand of like, testicles just came off and you just major pelvic surgery. Maybe you wouldn't feel like having sex either. And just to give it time to heal, give it time. There's time that is needed. And it doesn't mean the relationship's over. And it doesn't mean you're unlovable. And it's all the extra things we pile on top of what's actually going on with our body. And then there's the prolactin with breastfeeding, which can cause vaginal dryness, trouble with orgasm, trouble with lubrication. So lube in general, always important postpartum. Lube's always important no matter. If you're having sex, use lube. It's not a long conversation that I need to have with people. Lube helps people have more orgasms. And the clitoris is not a self-lubricating organ, and neither is the penis. So let's give both of them some lube. Why make the vagina lube everybody up? Lubrication, if lubrication's not enough, and also just for healing and arousal, vaginal estrogen cream. Now that's a prescription because it is a hormone, but it is safe with breastfeeding. But the studies really have shown that once you stop breastfeeding, it's still at about another 3 months for those hormones to normalize as far as lubrication, sensation, ability to orgasm after a person has been breastfeeding.
Oh, wow. I think, God, Kelly, how is this possible? I've had 3 kids. I am a physician. I actually did half of my training in OBGYN before I switched. And I don't even know that stuff because they don't effing teach it.
They don't teach it.
Bruh.
I know.
Crazy.
It's crazy. And then we all just think we're broken because nobody told us anything.
3 months. That's a long time.
It's a long time.
Especially when you're thinking, I should be back to wanting sex. We're shitting all over ourselves.
Should stop shitting all over your sex life.
Yeah, exactly. But I am 100% with you with lube and vaginal estrogen too. I think your vagina is like in a postmenopausal state, right? And so many people have discomfort and dryness and pain with intercourse and whatever we can do to help and support that.
Hey, Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood prenatal masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the 4th trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
Another conversation I have with my patients is, and I only started this after Alicia and I started doing this work almost 2 years ago now, but was realizing that just small little things like that intimacy and sex don't have to necessarily go hand in hand. And that one big thing was that you move sex away from like bedtime, because that's another thing. The evening's coming close, especially if you have kids, you might not be looking forward to sleep. And then you start having this like worry, oh my God, is my partner going to want to have sex tonight? And when you're not talking about it, you've just got that like, just going to climb into bed and pull the blanket.
Yep. I think there's two important points there that I love talking about. The first one is, if sex ever competes with sleep, sleep's going to win. You actually need sleep to survive. We don't need sex to survive. We need sex to survive as a species, but not as an individual. But we need sleep to survive as an individual, especially in the postpartum period where sleep is so messed up that if you put sex, like, yeah, everything else is done with the day, let's quick have sex before sleep. It's like you're exhausted and you're competing with sleep. Of course, you're going to resent sex or not be interested or not take the time or be rushed or whatever it might be. But yeah, I really like that, separating it from sleep or just acknowledging I can't separate it from sleep right now. Like my day is totally crazy, but let's understand why it's not going well because it's competing with sleep. And then the second thing is why I think scheduling sex in the sexperts, it's funny because you can get us on like a debate about if you should schedule sex or not.
I was going to ask you about that.
Yeah. But the whole thing of like, when you schedule sex, and the experts will say, schedule time for intimacy, not just putting something in the vagina.
Yeah.
But so when you schedule that time, it takes the pressure off of all the other time. Because if you're like, he's gonna proposition me again and I'm gonna have to say no, and then I'm gonna feel shitty for saying no. So you know what I'll do? I'll just avoid him and go to bed at a different time. And then what that does is you're breaking apart the intimacy of the relationship.
Mm-hmm.
All because we want to avoid having to say no to somebody or not having to say yes to something we don't want to do. But if you're like, Sunday, when the babysitter's here and we're going to have whatever it may be, or they're taking my baby on a walk or whatever, nap time, that's when it's going to be. Now we say, you know what? I actually really, and this is the communication part, I really hate saying no to you. I hate saying no. But when you ask me all the time, I have to say no a lot. And it makes me, I actually feel really bad saying no a lot. So can we put apart a time where I'm going to say yes? Because I really want to go to bed with you, but I just hate saying no to you. But yeah, so that's what people do. When you start avoiding sex, you stop holding hands, you stop going to bed at the same time. That's where the intimacy really goes apart. It's not just the sex.
Yeah. So having a conversation about it and also scheduling it can be beneficial. And I think some people argue that seems like unromantic and not spontaneous, but I think you've just answered why that can actually be helpful, right?
Yeah. Again, it's the sex exceptionalism. Like, sex is special. We shouldn't have to schedule it. I have to plan to eat vegetables. I have to plan to get 8 hours of sleep. I have to plan to exercise. Like, our life is not spontaneous. We're busy. We've got a lot going on. Why is sex the only thing that's supposed to be like spontaneously desired in the rest of this complex life we're living?
I've never thought about it that way, but it's so true. And especially when you have young kids, like our lives are like, if it's not on the calendar, it doesn't happen.
Yeah. The other important thing is sex orgasm more than sex. Because I believe, and this is a whole nother podcast probably, of the amount of women who are having shitty sex. But if let's say you're having great sex, let's role play for a second. You're having great sex and you have an orgasm. Now that's a dopamine dose. So it's dopamine seeking it out. It's dopamine getting it. It's dopamine when you get it. Mm-hmm. What we've done in our society and in our world is we've provided all these other amazing opportunities for dopamine. Mm-hmm. So now sex is competing with the couch, Netflix, and Haagen-Dazs, which is amazing dopamine. Sex is competing with the couch. The couch and alcohol and a sport game, which is dopamine. Yeah. Of course, you want to sit on the couch and eat your Haagen-Dazs and watch Netflix because you get dope. It's a reward. And sex is also a reward. But it's almost we're so fulfilled, air quotes, of getting dopamine somewhere that the dopamine from sex, some of us, especially if we're having crappy sex, we're not getting that dopamine hit from it. Or at least understand why like Haagen-Dazs on the couch sounds just about as awesome as sex is because it literally is. Like sugar's more addictive
Yeah.
than cocaine. Like they feel so broken. They're like, why do I just want to like sit on the couch and eat ice cream instead of having sex? It's like, because to your brain, that's winning.
Yeah. Oh my gosh, that's so true. And it's funny because I do addiction medicine as well. And I have these like graphs of the dopamine from sex and the dopamine from different substances, but it's so true. And especially when you think about the effort that you have to put in to have
Yeah.
sex versus the
Oh, yeah.
effort that you have to get in to pick up a pint of ice cream from the freezer.
Haagen-Dazs gives me a reward every single time.
Yeah.
Sorry.
So do you have it briefly touch on that bad sex? If that's part of the problem, right? Like, how do we address that? Like,
Women are having bad sex.
yeah,
So have you guys talked about the orgasm gap?
no.
Super important concept. Okay, so the orgasm gap was they've talked about it in research for a solid 10 plus years. I forget when they first came it out, but they did research and they said there's two amazing research articles on this. The first one was just looking at people who were partnered with whom and how much of the time they had orgasms. And again, you could say sex is not all about orgasm; it's about pleasure, but we use orgasm as a marker for
Yeah.
pleasure, right?
Yeah.
So heterosexual men, they're on top. They're having orgasms about 97% of the time that they're having sex with a female. So
Holy cow.
heterosexual men, they're winning at the orgasm acquisition game.
Yeah.
Then you're followed by homosexual men. Then you're followed by lesbians, women who have sex with women. And then you had at the very bottom by a large margin are heterosexual women who are having orgasms about 60% of the time. So she's with a man, he's having orgasms 97% of the time. She's having orgasms 60% of the time. You talk to a lot of women and they're like, yeah, if you're lucky, 60%. So that's interesting. So then you can say, maybe it's just a problem with the heterosexual women. Maybe there's something wrong with them. Well, how do we study that?
Yeah.
We can study that in two ways. We can say, how successful is she at orgasming when she masturbates? Turns out she's successful 97% of the time. She's also successful within about 3 to 5 minutes, which is where the male is masturbating.
Mhm.
Whereas when she's partnered with a male, she can take up to 20 to 30 minutes to have an orgasm. That's mind-blowing.
Interesting. Yeah.
Second study you want to do, of course, then, is you want to take bisexual women. And you want to say, all right, bisexual
Oh my
women.
gosh, interesting.
It's such cool research. So you say, okay, bisexual women, when you're with the men versus when you're with the women, what happens? Because it's the same woman with the same body.
Mhm.
Her orgasms go way down when she's partnered with the man. Heterosexual women are having crappy sex.
What do we do?
And then you say, and then
we do.
we'd have to talk about it.
Yeah.
And we have to talk about it. We have to have sex education, right?
Yeah. Yeah.
And I think it really should be a female led because the men don't have our body parts.
No.
They don't even know. They can't practice. They don't know. And
Mhm.
they're just supposed to know. We give them all the power. If he didn't give me an orgasm, it must be a problem with me. So it's certainly sex education, communication, and then priorities. So what heterosexual couples do when you research them is they prioritize the male's orgasm. And sex ends once he's had an orgasm. And if it takes her 30 minutes and it takes him 5 minutes, she's left lacking the majority of
Totally.
the time. So we have to change our paradigm. We have to say
Mhm.
heterosexual sex should just be like sex of all the people who have sex. It's a broad definition. What gives her pleasure? Let's do more of that. It's the
Mhm.
clitoris.
Mhm.
Vibrators, oral, hand, whatever it is.
Mhm.
I'm like not in this business to tell people how to have sex, but it's like what I do know is that heterosexual paradigm of sex starts when you put something in the vagina and it ends when the
Yeah.
male has an orgasm is completely unsatisfying to at least 50% of that partnership. And then she doesn't want to have sex because it's not rewarding. The Haagen-Dazs is way more rewarding. The Netflix are way more rewarding. Sleep is way more rewarding. Playing with the kids is way more rewarding. She's not getting a reward, which again is from addiction medicine. You don't get a reward. You don't get that dopamine that tells you this is an activity worth
You
doing.
want to do it again. Exactly.
Yeah.
Oh, that's so fascinating. So it all comes back to communication
I
and
think
just
so.
that openness. Yeah. And wanting to talk about it. And And I think a big thing you touched on earlier, and I mean, again, this would be a whole other conversation, is that growing up, how old am I? I don't know. I'm in my early 40s somewhere. Don't you find it the older you get, the less you realize exactly how old
You have to be like narrowed to 30, 43, no, 41, no,
I know.
42. Yeah.
Totally. I'm somewhere in there.
You like have to hone into your age when you get older.
Yeah.
Feels warmer.
But we grew up with, you know, kind of that, like that sort of almost Madonna horror thing, right? Like exactly like you said. And so we feel like dirty or shame if we talk about sex and what we want and our desires. And so there's a lot of, I think, work that probably has to be done and as an individual and with the partnership to feel safe having these conversations.
Yeah, absolutely. When you're told your whole life that if you want sex, you're bad, and then you're trying to figure out why you don't want sex, right? Like it's
Yeah.
almost obvious
Totally.
because your family or your religion or your sex education or whatever it may be told you you're not supposed to desire sex because that means
Yeah.
you're bad.
Yeah.
And now you go to the doctor's office or your girlfriend's or a therapist wondering what's wrong with you because you don't desire sex. That's we're completely conditioned
Yeah.
to be bad if we desired sex. So there's, again, it's why this topic is so fascinating to me. It's because it's relationships, it's hormones, it's your body, it's society, it's the way we were trained, it's our limiting beliefs. Like it's such a big, huge, I don't know if I like the term juicy, but it's a big, huge, juicy topic of prioritizing your importance in a relationship, communicating your needs and your boundaries, communicating that pleasure to you will make you want to have pleasure more.
Yeah. It's just that cycle, right? If you have good sex, you're going to want to have more sex. If you have bad sex, you're going to want to eat ice cream instead.
Yeah. Watch out. Haagen-Dazs will give you the hit every single time. Yeah. Whatever your drug of choice is.
Do you know much about the research around mindfulness and improving sex?
Oh, yeah. Look at Brotto, who lives
Yeah.
in BC.
Yeah.
Canada has all the good sex researchers because Canada funds it. There's funding in Canada. Canada has stolen a lot of American sex researchers because you give them funding.
I'm sorry.
Which is so nice. I know, at least they can keep doing their research.
Exactly.
But yeah, so Lori Brotto's
on that. Yeah.
Yeah, her book, I have it over there.
It's like better.
Magnificent Sex is good too, but better sex through mindfulness?
Yeah. Yeah. I think
Lori Brotto?
Yeah.
So she is a sex researcher. She kept having all these women come in and be like, I'm so distracted. I can never focus. Women do a lot of, and again, I'm gender stereotyping, but so here we are. But a lot of women will spectate, right? And so spectatoring with sex, is he having fun? Does he think my thighs are too fat? Am I doing this right? Why is this taking so long? What do I have to do tomorrow? Did that presentation at work go well? I'm not enjoying this at all.
Totally.
Right? So that's spectatoring. And so one of her questions was like, well, mindfulness, and some people don't like mindfulness. Some people will say like awareness or presence, whatever you want to do. But basically the practice of seeing your mind have thoughts and then coming back to the present and not judging in a non-judgmental way is the other part of that. Not like, there my mind goes again, God damn it. You know, like in a very loving way of, hey, I'm thinking about the socks that need to be washed. Let's go back to my clitoris.
Yeah.
So it's non-judgmental awareness of the present moment, letting those thoughts go and come back. So what she did was she basically had these women go through mindfulness teaching, meditation, and then basically track like, how does that translate to your sex life? And all like satisfaction with sex went way up. Because if you look at the other reason I like this is it's all neuroscience of like the orgasm can't exist in the brain. And nucleus accumbens, really that central part of the brain where orgasm is, it can't exist if the frontal lobe is activated and working.
What?
Yeah. So you have to.
Fascinating.
It's so good. Like one of the chapters of my book is like, you can't frontal lobe this shit because Western women are like, just tell me tell me the 5-step plan to blah, blah, blah. And it's like, you can't frontal lobe this. You literally have to let that part of your brain offline. You have to let it go.
Yeah.
So every time it comes back on and you're judging or you're trying to figure it out or you're working real hard to have an orgasm, you got to let it go to get back in the body. And again, that's where that mind body dropping back into the body, breathing into your pelvis, breathing into your clitoris, lifting up your pelvic floor muscles. And so many women and men too, but we're talking about women, are disconnected from what their body feels. Does my body feel safety? And again, good sex comes in from people being in their body, being aware of what feels good, what's a yes, what's a no. Not just like, where's he touching me? And if I didn't have an orgasm, it's my fault.
Oh my gosh. It's so complex, yet there's some very small, simple things we can do.
Yeah, and it's
Actually,
a practice. It's not like you're gonna read a book and have an amazing sex life forever. This is the other stereotype I think is super important for like your postpartum
Mhm.
and pregnancy people is it's okay to have bad sex. Sometimes it's just not gonna work.
Mhm.
And it doesn't mean it's gonna be bad. But the fact that you like continue to show up and you try new things and you talk
Yeah.
about it, and then you decide to talk about it again next week when you're out on a walk and it feels safe. Like talking about sex is not one conversation, it's your life.
Yeah.
But the people looking at again, the book is Magnificent Sex by Peggy Kleinplatz. Looking at the people who have magnificent sex, they're excellent communicators. They're super in tune with their body. They prioritize pleasure. They work at what you need to have a great sex life. It's not just like this. Great sex isn't an accident, especially in long-term monogamous relationships.
Oh, that is a great quote. Great sex
Not
isn't
an
an
accident.
accident. Oh, that's fascinating. I feel like I could talk to you for another 12 hours. And so I really hope we can.
It's such a huge topic.
Oh my gosh.
Yeah.
Like our time together flew by. But I think the major themes that I'm drawing from our brief conversation is communication, just normalizing, right? And understanding that, you know, postpartum, it's very common for people to have low libido and less interest in sex, but that communication, getting to know your body, being open with your partner, using lots of lube, and just practicing being in the moment are small things that you can do to work towards magnificent sex.
Magnificent sex. Yeah, absolutely. And even normally, and like, how do you start talking to your partner about this? So giving them fun facts. Did you know that a lot of women don't enjoy sex after having a baby because they feel totally touched out and their
Mhm.
dopamine isn't firing because of all the prolactin? Did you know that? And they're like, I didn't know that.
Totally.
Instead of, don't touch me.
Yeah. But it's
You're
so
like,
true. And I think what you mentioned was we just leave so much unsaid. And the looking at a heterosexual couple, because these are the ones that have the worst sex, especially the female partners, is that they're feeling touched out, but they don't want to talk to the partner about it. So then there's this like vicious cycle, right? So they pull away from the partner, and then then they think the partner thinks they don't want them, and the partner, like it's
it's all of our
for
assumptions.
disaster.
Yeah.
Totally.
Books in the backpack. We make it
We
worse.
assume. Right?
Yeah, exactly.
Yeah. Oh my gosh, Kelly. Okay, so Magnificent Sex. I'm a book nerd. It takes me a while to get through them, but
Yeah.
what was the other one you suggested?
Magnificent Sex, and then Mindfulness one's a little bit dense. So if you're like a
Yeah.
researchy type person, I would do it. I wrote a book about sex coming out because there's two types of sex books, I think, in the like dozens that I've read. There's the super academic books,
Yeah.
which are really tough for a lot of people to digest. And then there's the breathe into your spleen, call it a yoni, and find your chakra, which is great, but I don't think that's practical for your average Western woman who's, I just want to feel not broken and like normal and like
Mhm.
maybe have some good sex every once in a while.
Yeah.
So to me, I'm like, I need the book that is the culmination of all of that. And so that's why I finally put what I talk about in my podcast all the time into a book form.
Amazing. And what's
Coming
your
soon
book
to
called?
Amazon.
Yeah. What's your
You Are
book
Not
called again?
Broken. It's called
Yeah.
You Are Not Broken. Stop shitting all over your sex life.
Okay. Amazing. I cannot
So-
wait.
But if you're super into the research, Better Sex Through Mindfulness by Lori Brotto.
Yeah.
It's good.
Awesome. Thank you so much for your time, Kelly. I've just loved chatting with you.
Thanks for having me.
Well, and we're so close. Maybe someday we can meet in person.
I know, they just opened the border.
Yeah.
I heard.
Well, I'll bring my husband down to mountain bike, and you and I can go drink wine and talk about sex.
Yeah, we'll pray for the mountain bikers. It's real down here. We have hills.
Yeah. Okay.
Awesome.
Awesome. Thank you.
Thank you.